Hello everyone, welcome to my channel. Here I'm showing you today the nursing care plan on asthma. My previous video is on tuberculosis and you all give a lot of love to that video, so that's why I get inspired and try to post my new video on the nursing care plan on asthma. Please give more and more love to my videos as I get inspired by your views, comments. Okay, so let me start from biodata of the patient. I also guide you in my previous video of nursing care plan of tuberculosis, but here I also give you an overview again. First of all, here is our biodata of the patient. Each and every NCP started from the biodata. Biodata is very main and important to have. So in biodata, we should take a name, age, sex, marital status, ward, CR number is a file number, bed number, religion, education, occupation, all that it's considered into the biodata. After collecting the biodata of the patient, we have to know and write up about the chief complaints. Chief complaints is that from which the patient is suffering from. Like the patient is suffering from cough from 5 days, fever from 1 week, and dyspnea is from 6 days. Dyspnea is breathing problem. Okay, so after write down the chief complaints, we comes to the past medical surgical history, present medical surgical history. So we have to write what is the past medical history of the patient, what is the past surgical history of the patient, may patient having any surgery in past. So we have to write and record each and every surgery or medication patient taking in the past already. So we have to conduct already the present medication and surgery history. Okay, after conducting all the history about biodata, medicine and surgery, we have come to the family history. So we have to know about the family members of the patient, they are healthy or not, is there any family problem or family disease. For example, diabetes is our family disease. So we have to know about each and every family history of the patient. Then we have to make the family tree. For example, okay, here is the patient is Harpal Singh. Okay, he's unhealthy. So here is the wife Kulwantkar of the patient, and there is two children of the patient. One is a female and one is male. So we have to make the proper family tree of the patient. After family tree, we comes to the vital signs. Vital signs is the basics of the nursing. So in nursing care plan, we have to record the temperature, pulse, respiration, blood pressure. So we have to write down the normal value and the patient value, then give to the remarks. Okay, then we come to the lab investigation. So lab investigation will check from the file. You have to go to the hospital, then check the file of the patient. In the file of the patient, there is a total record about the blood test, WBC test, platelets test, each and everything written on the file of the patient. You should check from there and then write it down, the normal value of the HBs, WBCs and each and every test conducted in the file of the patient. Then write down the normal value of that test. Okay, after taking the lab investigation, we comes to the medicine chart. So we have to maintain the record of the medicines. Okay, so which medicine is given to the patient. Okay, so here for example, we are giving the amoxicillin to the patient. Amoxicillin is dose. We have to give the 50 milligrams of amoxicillin IV through intravenous route, and frequency is TDS. TDS means 3 times a day, BD means 2 times a day. Okay, so we are giving amoxicillin 3 times a day, 50 milligram intravenously. So what is the action of the amoxicillin? It's an antibiotic, means antibacterial. Okay, after then comes to the physical examination. I'm not here going to explain each and every point of physical examination. If you want to see, then go to my previous video of tuberculosis. Here I explain each and every point. Then after physical examination, here skin, we have to examine each and everything of the patient's skin, nose, mouth, throat, neck, okay, head, face. Means in the physical examination we have to do head to toe examination of the patient. After doing proper examination comes to the nursing assessment, that what the nurse assess. Okay, nurse first of all assess the condition of the patient, from which condition the patient is suffering from. Then we have to conduct the vital signs, as we I already tell about that previously. Okay, after that we have to assess the nutritional status. Nutritional status is very important and crucial, because maybe the patient is suffering from dehydration, or maybe patient is suffering from malnutrition. So you have to assess the nutritional status of the patient. After nutritional status, breathing pattern should be assessed by the nurse. Why? Because oxygen is the primary requirement of every patient, so we have to assess the breathing pattern. Or it's very important in the condition of asthma mainly. After that, assess the knowledge level of the patient, because if the patient having no knowledge about the disease, lack of knowledge is there, then you have to teach the patient and give knowledge properly about the disease from which the patient is suffering. After that is nursing diagnosis. Okay, so we have to properly maintain the diagnosis of the patient according to the priority wise. Okay, so first of all, in the asthma patient, what is the priority to that patient? That is insufficient breathing pattern. Okay, so in the asthma patient is not able to breathe properly, the patient having an insufficient breathing pattern, related to the narrowing of the bronchi. Because of the asthma, the bronchioles get narrow, as evidenced by the cough and dyspnea. How we should know that there is a narrowing, or patient is having a breathing problems, ineffective breathing, evidenced by the cough and dyspnea, with the help of we having an evidence of cough. Okay, so next is the ineffective airway clearance, related to the pulmonary secretions, as evidenced by the wheezing sounds. So when the patient cough, here we sound the wheezing sounds, from which we know that there is a secretions in the airway of the patient. So we have to need to clear the airway of the patient with the help of suctioning. Okay, so next come to the fatigue, related to the respiratory efforts from the breathing. So when the patient takes too much efforts for the breathing, there is also fatigue means the patients feel lethargic. Okay, as evidenced by the exhaustion and the lethargy. Next is the anxiety, related to the hospitalization, as every patient may feel anxiety, evidenced by the facial expressions of the patient. So you judge the anxiety from the face of the patients or the expressions of the patients. And after that, we have to write down the short term and long term goals. Here we have to maintain the goals to achieve that goals. Okay, here is the short term goals is to improve the breathing pattern, to clean the airway, to reduce anxiety, to make the patient able to eat and drink, improve the physical activity. Long term is prevent the further complications. Okay, so care of the patient, so encourage the follow-ups of the patient, and remain the airway clean. These all are our short-term and long-term goals which we need to achieve. Then comes to the main point, that is our NCP nursing care plans. Okay, so nursing care plan, we have to make the columns of assessment, diagnose, goals, plannings, implementation and evaluation. In the assessment, what we should assess in the patient, that there is two types of data, subjective and objective. I didn't written the objective data. Subjective data is those which we contacted from the patient, and objective are those which we observe in the patient. So okay, so here subjective patient said that when he breathes, sounds are produced with breathing. Okay, so what diagnose we will make, that is an ineffective airway clearance. Okay, what we judge from the subjective data of the patient, that the patient airway is not properly clean. Here is the secretion accumulations, so we can evidence it by the wheezing sound. So what about our goals? What should here we need to do? We have to clean the airway of the patient, and it's clear in our diagnosis. So we have to do planning to clear the airway of the patient. For the clearance of the airway, we have to first of all here assess the vital signs, assess the breathing sounds, elevate the head of the patient bed at 30 degree, do suctioning. Suctioning is the main point. With the help of suctioning, we have to remove all the excessive secretions present in the pulmonary area of the patient. Do chest percussion. With the help of percussion, be able to remove the excessive secretions of the patient. Implement means what we plan we have to do. Okay, after do implementation, evaluation, that airway of the patient get clear after 72 hours of the nursing intervention. So here I tell you all about it in the detail. Here I have the more NCPs. You are able to take the screenshot of these NCPs, as I'm not going to explain all that. Okay, here I also written down the objective data, and this isn't related to the anxiety, related to the hospitalization. And one more on the ineffective breathing pattern related to the narrowing of the bronchioles as evidenced by the dyspnea. Okay, here at the end, I also write down the health education. We have to educate the patient about the diet, exercise, follow-up, medication. Okay, so here we completed out our nursing care plan on asthma. So please subscribe my channel, encourage me for making the more and more videos as I want to post it. Okay, thank you very much to see and cooperate with me.